pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. I hope everybody had an opportunity to review the minutes. Can I get a motion? Second. Got a motion, got a second. Any changes, adjustments, discussion? All in favor for approving the minutes?
Aye.
Okay, motion carries. All right, let's go into PS1, resolution authorizing the creation of one position and deletion of one position in the sheriff's office. Who's talking that? You were trying to that's the
Benjamin's.
Yeah, Benji's retirement again, and
Yeah, Chief Benjamin retired. The two lieutenants we have running the jail now, neither one of them want to take the job. So they don't want to give up their civil service position. So our solution is to reorganize a little bit. And with the savings and salary, we want to bump the lieutenants up to so they're about on par with the road patrol lieutenants. And they're going to take control of the facility. And also in that savings, we want to put an additional sergeant on with administrative duties. And with all that, it still ends up being saving, I don't know, what was it?
$7,688.
so you're gonna have two lieutenants and a sergeant?
Yes.
Total?
It's an additional sergeant that would be on the day shift,
Okay.
and then the two lieutenants that we currently have, we're just bumping their salary up and making lieutenant clears for the chief operating officer that reports to the state. So he does a lot of our training now, so that's why we're putting in another sergeant on days who would take over the academies and a lot of the training stuff we do during days. But it'll also give us another supervisor, keeping us at the same amount as we had when we had one Benjamin.
What was the savings calculated?
Savings to bump the two salaries up and add a sergeant would be $7,698.
How much were you able to bump up theirs?
Well, it says here that,
They're both about 15,000 they're being bumped up.
Okay.
They're both making probably the same as most of the sergeants in the correctional facility now,
Okay.
but they're lieutenants, so they're something we were going to need to address anyway. And by bumping them up, like I said, giving them a lot more responsibility, we're bumping them up to be equal to the lowest lieutenant we have in road patrol.
Make a motion?
of course, I'll have to go through F&P, right? So
What's that?
that part will have to go through F&P, right?
Yes.
You know, we'll approve the changes here, but, all right, is there any, so we got a motion discussion, right? Do we have any other conversation? Go ahead, Frank.
I just want to, it says it's mandated medical services in this whereas.
Yeah, the MAP program.
Right, but, so the,
It's another one of those state unfunded mandates.
Honestly,
right, so.
I think what that was Sheriff and I were out of town last week at the State Sheriff's Conference. And our secretary did this, and we didn't see it. I did read that this morning.
Right, that's why it didn't make any sense to me. I thought that, maybe we were getting another doctor again.
The lieutenant that's a supervisor does oversee the MAP program for us with medical.
Right.
And I think she just left that in probably from something else. I think it just doesn't have much to do with the mandated
I didn't
medical.
think so. That's why, that's why I was reading it and I said, well, this doesn't make any sense. You gotta change the whereas on this.
Right. I agree with you, Frank. I was gonna point that out to them. So maybe we can get this reworded.
Then we would have to, legally, politically, and you'd have to vote on it again, or make amendment right now to take that verbiage out.
I think we just take the first paragraph out.
Yeah, and I think that was just in the.
Right, so we make it, I make a motion to amend it correctly.
I'll second that
Yeah.
motion.
And remove that first
Right.
paragraph.
Paragraph. So we're making a motion to amend this by removing the first paragraph. Okay, we get a second? I second it. All right, so any discussion? Anybody disagree with that? Everybody okay with that, comfortable with that? Okay, so all in favor?
Aye.
Any opposed? Okay, as amended. So now let's go ahead and approve this as amended. Can I get a motion?
I'll make a motion.
Any further discussion? Got a second? We got a motion? Okay, all in favor?
Good.
Any opposed? Good, motion carries. All right. Yeah, that was a little bit awkward, just a minute in there. All right, and then there's PS2, which is an insurance recovery for $900. We hit another gear. Taking a motion on that? Thanks, Herb. Frank, we got a motion. And a second? Okay, any discussion on that? Frank?
Is there some way that we can get the deer crossing sign so that, you know, I mean, you're watching for them at the deer crossing. If they're not
Put the
crossing
signs up.
that thing, then I don't think we should be held liable for that.
I agree.
Free hunting patches.
Yeah. Deer jaywalking?
First gotta know how to read.
Tag them. All over. Bagging and tagging.
Any further discussion on that? All in favor?
Aye.
Any opposed? Motion carries. Okay. Let's move on to CSI update. Okay, we're having another conference on that. Did we schedule are we meeting after the, I wasn't there. That's what I'm asking.
Nor was I.
And you weren't there either.
Yes, I
So
believe
are we
so.
meeting after, I know we're gonna have a conversation today, but are we,
I think it was set up like we always have it after.
so we're gonna, it's scheduled for after
The legend
the
of
ledge meeting? It is, okay. So our next meeting is, after the ledge meeting,
And
next
today,
Thursday.
we got a meeting today.
Right.
Right after this.
No, full leg meeting.
No, I'm talking about.
Yeah, we're having a quick meeting on it today.
Oh, yeah.
Instead of doing that. Trying to get these committees set up, squared away. Okay. All right, so, you have any updates for us from the CSI? Okay. All right, fair enough. Anybody else? Kevin, you got anything? Did you do any, updates on the, yeah, well, I'll get that. I'm sorry, I'll give you a minute. Did you do any more work on the camera stuff?
The superintendent that I was gonna work with is retired, and the backup superintendent that Mike Gated put me in touch with has retired. Well, I guess they moved, they didn't retire, but, so he's gonna be sending me some more contact info for Hannibal schools to try out there. So, and I did start a discussion with Central Square also.
Okay.
So, we're trying to make some movement on that. So, but unfortunately, our two big advocates, I believe they both went to Watertown schools.
But the technology is there.
Correct.
And did you research the costs? That's the,
Well,
I know, we know the technology.
until we know what they have and what's gonna be required by their
We can't set up any
IT to figure out VPN and stuff like that, I
Okay.
don't know.
All right, we'll worry about that. No. All right, so let's go to, reports, department reports, EMS. Nick?
Good morning, everybody. It's been a little bit since the last report, but it's been pretty busy since then. All of our 2022 fall EMT classes wrapped up. Amongst the 3 classes, we actually had 17 students pass their class, so we're pretty excited about that. It's a pretty good number. Looking ahead this upcoming year, we have an advanced EMT class, which is kind of that intermediate level between paramedic and EMT. We're going to run one of those classes in Mexico in May, and we are looking into running an EMT class in Fulton starting hopefully end of March, so working with the instructor on that. Also looking ahead to the rest of the year, we have a possibility of a 4 hours class just for current EMTs to refresh their cert coming up in a couple months as well as a potential EMT class in the North Country in August and that timeline. So roughly for the year, it's kind of what we're looking like for classes at this moment. The hospitals continue to struggle as always. They are getting a little bit better. There seems to be a little bit better management of where patients are going and how they're getting there amongst the hospitals. We're still seeing that pretty long wait times. Not uncommon to see a 3 or 4 hour wait time at the ER. MCI equipment has been a little bit changed. We used to have trailers. The trailers are no longer in service, and we've switched to cash equipment. That's strategically placed throughout the county. This equipment has a lot of bleeding and trauma control, as well as MCI like vests and the MCI plans and more like administrative stuff. in them as well. So we're pretty excited about that, and we've been working with Shane in his office on getting those deployed. Other than that, been busy attending a lot of different types of meetings and calls countywide. Just trying to stay, involved in as many different things as we can. So
Thank you.
if anyone has any questions.
No, but I did neglect to go back to Frank on the previous, I apologize, I just did. I realized after I had already started, so.
Right, we can talk afterwards, because I think it was in regards to
What we were
the
discussing.
motion that I had made in June about eliminate task force. Okay, so we can talk afterwards.
Fair enough, okay, I just didn't want to, I did forget about you.
That's okay, that's all right. I'm easy to forget.
I'm sorry, how many hours is EMT training?
150 roughly. Minimum, our classes tend to flex up to 160 about 150, 160. And the advanced EMT class is the same time commitment.
I know there are other sheriff's offices now, just came up with our conference, that are training deputies as EMTs because they're in such dire straits. I'm not proposing that because I think we're crossing the fire and EMS with deputies, but you'll hear about it. It's gonna start happening more and more because all the sheriff's departments are starting to adopt it.
Well, as we further decline in the available workforce, guys are going to be wearing multiple hats more and more, I think. It's just going to be the reality of the paradigm that we live in.
That also carries a 3-year research commitment as well, just so you're aware. So there's a certain amount of hours that need to be done through continuing medical education, or they need to sit through an additional refresher class every 3 years.
Some of the sheriff's departments, it was voluntary, and some of them, the sheriff just said, you're going to EMT training. And the union just fought it.
That's an interesting model since it takes them out of service as law enforcement for patient care.
Mhm.
I think it's a good idea, really. They're the first on the scene 90% of the time, and you're sitting there waiting for the ambulance to come, and the person might need an assistant. If you had somebody had a little bit more training than the average roadman,
Basic first
I think you might save a life if you're there.
I think the model that they have of them driving, what we used to, from Syracuse PD, and I'm sure with NYPD, bigger agencies, it's emergency services truck. They don't transport victims, but they're, I mean, I don't know where it's going. We're all hurting for employees.
I'm confused. They won't do it then when they're out on regular law enforcement.
I think the model is, you have to look at each sheriff's department, how they're doing it. I think there were 4 of them that said they're doing it. They would have medical equipment in their vehicle, but not transport patients.
Okay.
You'd still wait for the ambulance to get there and transport.
It would be just like Nate has a jump bag in the back of an EMO car. He's a certified EMT, could provide some care, but we don't have oxygen, we don't carry oxygen, et cetera. So tourniquets, sheriff's department already carries tourniquets so they can stop life-saving, bleeding or life-threatening bleeding. But he has airways. He could do like a plastic airway, but.
Well, everybody's getting first aid training, right? That's part of their training, but I guess it wouldn't hurt, as Herb said, to have extra training, but can you afford to send the guys for that training at this juncture, right? Probably not. You're going to lose manpower to send them out to training. That's something that you do when you guys are guys, right? I'll talk about that further.
Also challenging too, if they don't want to be an EMT, then they're less likely to come to your agency.
That could be a problem too.
Yeah, I don't ever foresee forcing somebody.
Yeah.
We do have some members that are even looking for the SWAT team.
Yep.
Sure. Yeah, you probably have guys that are EMT before they become up.
Yes.
So it does translate from position to position. All right, Kathy, you're up.
Happy 2023. So 2022 for us was extremely busy, and we really thought 2023 we would recapture some free time and get to some other things, but seems like it's really pushing along. We've got a lot of planning initiatives going on right now this year as well. We starting to update our comprehensive emergency management plan. The update that we have in that is very old, and we started a process back in 2018, but it didn't get followed through, so we're redoing that right now. We had 2 days of training at our office last week where we brought in a bunch of our county departments and offices and some stakeholders from the outside that are helping us to update that plan. We're using the same online model that we used for our COOP plan update, a continuity of operations plan, where bold planning comes in, and it's a web-based platform, so it's easy to update, easy to input information, and I think that feedback we've gotten so far has been positive for both platforms, so we're happy to do that again. We are still underway with the mass fatality tabletop exercise we have in the spring, so we're working with a vendor for that. We are looking at bringing a vendor in for web EOC to get additional people trained on the platform, and we don't have a lot of time to get into the platform ourselves because of all these initiatives, so we're looking to bring in a vendor to help us with that. So we will do that with our regular EOC training we do before our exercises. We have 2 radiological exercises this year, one in May, which is a practice exercise, and one in June, which is our FEMA evaluation exercise. So conversations are underway with our utility and FEMA in New York State, and working on the extent of play for that. So knee-deep in a lot of plans that we're getting ready for. We did have successful FEMA evaluations with both Mexico and Oswego school districts. They come in and take a look at their plan for evacuation purposes, KI plan that they have in place for radiological incident. That went very well, so it came in an interview style. Both school districts willingly participated and did an excellent job, so we were happy with that. We did have a successful post-plume tabletop exercise, which is aftermath, you could say. So after the plume settles, where does it go? We had a lot of stakeholders and county departments that helped us with that. So that went very well. We are out of the COVID supply list now, but we are still supporting any requests for test kits as long as we can still get them. So we still do have some if anyone needs them for municipalities or anything like that. We do have some of the test kits available for that home ones. As for the drone program, just to recap, in 2022 there were 609 flights or missions, you could say. 353 were for the city of Oswego, 237 for the county, and 19 for Novellis. So the drone usage was quite extensive and probably used very well. The tactical drone has been used several times in the month of December, so that seems like that was a good purchase, and it's got a lot of intel and good information. We used the drone at the 911 open house. I think that went very well, gave people an opportunity to see that drone is the first responder piece that we're looking to push, in 2023. I think it helped push some of the people that showed an interest in that as well. The FAA has announced that there's going to be a drone safety day in end of April, so we're looking to be a part of that event and demonstrate some of the capabilities and answer any questions for the public. So we're looking to participate in that. Lastly, as you can tell from the little graph I included, water levels are low again this year compared to even last year. So we'll see where that goes in the spring. And that's really all I got. Anybody have any questions?
Yes, if you've got more.
I just want to say thank you for having that open house. I mean, thanks for setting the bar for the other departments to follow along with maybe a similar program.
I thought it was fantastic.
What an amazing turnout. And how many people signed up for the test?
We have 133 applications.
133 applications. And how many normally? Have been?
The past 6 years since I've been here, no more than 18.
So yeah, good for you. Good for you. Great job.
Almost too many. Well, it is too many.
Is that,
25.
you attribute that to adding the drone program, or you attribute it to just?
I think all of it all tied in together, to be honest with you. I mean, before the open house, we were at 71.
Oh,
so,
71 guys signed up. Oh, okay, good.
So, I think we had the social media push starting months and months ago, definitely got it out there. I mean, we had excellent news media coverage leading up to the open house, and then after the open house, and then with the open house there. I mean, we had very good turnout during that day. So we've been doing, not to butt in this time, but we've been doing some interviews for the provisional positions, and which with having that many applications is very, very scary. But we've been moving forward with those anyways, and the reason how people heard about the exam were right across the board: Facebook, social media, news media, newspaper. I mean, it was, so we've seen it all, which is excellent. Man, that's exactly what we're looking for. Try and hit it from all angles, and it seems to have worked.
I don't know who's handling your Facebook account, but they're doing a fantastic job also.
Yeah, it's our new part-time typist. She's amazing.
Yeah.
So
Great job.
we're not telling Kelly about her. So.
I think the piece of that too is he's done it, like he said, all of the push beforehand was huge because there's other counties that have had open houses and have not gotten that level of interest in the program. So
Great to hear.
whatever they did was a good job.
Thank you.
Renee?
If you would pass along kudos to the other departments for our comprehensive emergency management workshops. The consultant was absolutely floored that we had a representative from all 15 emergency support functions. So that included a national grid rep that came in and worked on that as well. So all of the 15 response areas were represented by people with expertise in that area. So really we're on our way to making a very strong plan, and we really appreciate the support of all the other departments in helping us to do that. Their input on their specialty area makes for very good plan on the back end. So we appreciate that. Thank you very much.
Thank you.
Very good. Any other questions for 911? Great job, Kevin.
Well, I didn't really get to talk about myself.
Oh, yeah.
Sorry. I told that at every meeting.
All right, so just to follow suit, then we'll stick with probation. No, that came from Kathy, right? We lodged it tonight. If you want to, go ahead. We'll jump back.
That's whatever.
Leave right at the, since we're on that.
So I do apologize for not getting you a report yet. It's been pretty crazy the past few weeks with everything that's been going on. So, but to end out last year, we did complete a coverage study that we did countywide, comparing Verizon mobile data coverage to AT&T mobile data coverage, and that we were seeing with the increased support from FirstNet and the FirstNet Authority and FirstNet, AT&T is a lot better in Oswego County. It's not perfect by any means, but we do have better coverage countywide that we did see by almost 20% increase in mobile data anyways. So we're going to work towards a transition this year of getting away from Verizon on the majority of our countywide mobile data modems, switching them over to AT&T to get them better coverage, better data throughput. So that was a pretty decent sized undertaking towards the end of last year. We already talked about the open house, which went really, really well. So the one negative, I guess, of getting that many applications is that when New York State decided they could step in and try and help us with the HELP program that allows certain job titles across the state to be able to pretty much not have to pay attention to the civil service exam this year. The number 2 criteria is that you have to, try and exhaust all options to try and get people to take your test, and still not get many people to take the test. And I think we exhausted every option we had, and people came out. So that would have been very helpful because it would have made probation or provisional hiring a lot more comfortable. But hopefully the 3 people that we really need to hire right now to make the rest of the year go the way that we need it to go. Hope they pass the test and score high enough that we can keep them. But I'm going to Albany tomorrow to do some lobbying, and that's the civil service discussion is one thing that we are pushing with some of the committees that we're meeting with, because we need more help there. Yes, I understand. We need to follow civil service law and we need to work through that, but we still need a little bit more flexibility. If we hire somebody provisionally, I feel that can do the job, and some of the tasks that, if they pass the exam, that should be good enough. They can do, it's something like 911. It's not everybody can do it. So, if they can show that they can do it and they can actually pass the test, then that's where the New York State 911 Board plans to try and push towards. So, along with some next generation 911 funding requests to add on top of the 911 surcharge from somewhere, as opposed to taking from the 911 surcharge even more and reducing the amount that they're already giving us back in grants. So we've got some work to do there. Hopefully tomorrow will be a good day and they'll understand our message to them. So
Good job, Paul. Can we mirror, we're aware of his plan, right, for his advertising for the job? So we can mirror that with our other departments and kind of get, you gotta get to the young people, right? TV and newspapers don't do it.
Age-wise, it was across the board. We were very surprised. I mean, we had a couple of 60-year-olds that applied for it, and I mean, that's good. So I take, wide range, wide backgrounds, so.
I'll tell you, if we can get them to give the waiver and let retired people work part-time, maybe 2 days a week and 3 days a week, maybe hire 2 guys part-time, I think we could get a lot more people in the door, I really do. But they don't, we've got the state waiver thing with the 35,000 that they can't go over, and most retired people don't want to sign up to work 5 days a week. But if you could split it, I think we'd get a lot of interest in retired people. And they're the only people that want to work, let's face it. I mean, no offense, but it seems to be the case today, right? That's what we're facing. All right, Kev, thanks. Yes, Frank.
I just had to make a side note here that I did get a tax reprimand for putting the 911
Open house?
open house over the Fulton City School District.
Oh, you had it? Okay.
The Prince sent me a text message saying this should be used for only, official business, and it should go through him before it goes out to everybody. But it hit every employee of the Fulton City School District.
Oh, terrific.
I mean, I don't want to say your employees.
Well, I thought it was important because you've got teachers that got it, could pass it on to students, and they got kids of their own. They have people that they know. Not everybody looks at everything, but when it comes over the school district one, he was a little upset. It didn't bother me. I had issues with it before, so. But if it happens again, I guess I better not do it.
On that note, maybe it would be wise if we could get some department heads to contact counselors in the high school, set something up.
Yeah, so like Central Square had started that discussion. It's my school district, so, but we are working with city as well.
Maybe we can get some direction and have them do some PR for us.
Yeah.
What's the minimum age for dispatch?
18.
That's good.
So we have an 18 about to turn 19-year-old applicant that looks stellar. So she was very, very surprising that you don't find many younger generation with the type of motivation that she appears to have. This gave us so. But we are working on, I don't know if everybody's aware, but we do currently have for years worked with New Vision's program, bringing them their students in for observation, typically 1 in the morning, 1 in the afternoon, or however it works out with their schedule. But we're working on setting up the same exact program with City Wolsey's public safety program. So.
Terrific. All right, let's go back to Dave over at probation. What do you got, Dave?
Just a few things. Excuse me. Additions to the report I submitted. Our numbers are pretty stable. Investigation supervision have pretty much stayed pretty level. Electronic monitoring's been extremely high, and pretrial's been really high, so that's been keeping us busy on that end. We've started the process of switching over all of our desktops to laptops and docking stations using our ERPA funding that we're approved for. So, and it's good timing because a lot of our desktops are starting to die little by little, so because they're going on like 89 years old. So it'll be a good thing to switch them over, and we'll all have laptops, so that'll be nice. I don't know if I mentioned before, but I belong to a council of probation administrators called COPA, and we have a summer conference that's like 3 days long that travels around the state. We put in a proposal as far as which county can have it. It's going to be here this summer, so that'll be kind of neat. There'll be like 60 probation directors that'll be here. So
Nice.
Good. And there was something that came up in ATI and it had to do with transportation for people after cap court, right? Wasn't there a question about the guy standing around all the time waiting to get somebody a ride? And I mentioned it to Mel. Did we look into that? I know you're not doing transportation anymore.
Yeah.
Can we get that resolved so that we don't have?
That's been an issue with day one of cap court. We were trying to figure out how it was going to happen. Because at one point we had bus tokens. We bought a bunch.
So what happens is the
I
engine
think
drops
it's
them off the cat court and they leave,
Yeah,
and then when they're done,
but I think it's,
they don't arrive.
yeah, but what time of day is that?
Well, it's usually
Well,
nights, right?
morning and
Night.
Both morning and night. I know that there's a time, in too early in the morning or too late at night isn't gonna work if it's during the day.
we tried addressing it through policy with the agency. I can't remember what the status of that is. They bring them in for arraignment. If they're bringing them in,
They should pick them up, bring them out.
and they turn them over to us, then they leave. But if they bring them in while cat court's open, they walk them in for arraignment. They never turn them over to us. They walk them in, and I think we kind of mandated that they have to stay, and if they get kicked loose, they take them back.
I think that's what we recommended. I don't know. I haven't heard
I don't know.
anything from it, so.
I don't know what process.
So it's working?
Well, we're at the ATI meeting, and somebody brought it up at the meeting about how there were, sometimes there's people sticking around waiting for these people who need a ride, and they can't go home until.
I mean, I know the biggest one that we dealt with was if somebody gets bailed out or released from the jail after there's no busing or after hours, now we've been in or incarcerated individual, getting out and walking down 481 or wherever they were going across the street, knocking on doors. So we actually use commissary funds to, if it's after a certain hour where we can't get a bus, we taxi them to where they're going if they're released between certain hours.
Gotcha.
It's like 7 at night to 7 in the morning.
Yeah, I don't know if there's something that can be set up.
Yeah, but if it was an individual thing though, if we were gonna do volunteer, a lot of volunteers might not want
Not
to.
want to do that,
Might
right?
not want to do that, that's the problem. I think that was one of the concerns, is they said, yeah, we could do volunteer people, but they're like, nah, I don't know if I want
It's like a
to do this.
voucher or something for them. Call them Uber.
Well, that's essentially what we were doing, was we were, but there's not a lot of them available.
Because Catco goes to like, what, 10, I think, right?
Yes, that was one of the issues too, it was later at night and nothing's running.
No.
You can call it that too.
Shane, you're up, buddy. I'm sorry, Frank, did you have a question?
No, I was just, in
That's the corner of my eye, I thought I saw you.
No, I'm paying quotation, that's all.
Coordinator's office, for the year end, 2022, we handled 282 incidences, 96 structure fires, 19 hazmat, 44 fire investigations, 4 dive, 1 rope, 87 no responses, and 31. So it was a busier year than years previous. Start of the year started slow, didn't start out like it did, but it's picking up already. List of classes there. I've got some instructor positions that I'm going to need to get filled here before April. So I'll be hiring a couple, 2 to 4 individuals that I already have openings for. I responded to Buffalo with Granby Center and Orwell Fire Departments for the snowstorm and assisted them with Buffalo Fire and AMR ambulance. We took 2 pickups and 2 UTVs. We were detailed out for the 3 days. Planning hazmat drills with both the city of Oswego and Novellis to help subsidize our county team. We will be doing that in the spring. Got an upcoming meeting tomorrow with representatives from all the buildings to go over building the safety plans and the layout of which to the best way to suit that, get that done. So that's tomorrow morning, 10 o'clock. And I'm upgraded the sprinkler lab down in the lower classroom, new valves, and I'm waiting for another quote on alarm panel setup for that, because there's been a large increase from some of our industrial departments in regards to sprinkler operations and alarm panels. So just a small upgrade down there. Any questions?
Wasn't there a barn fire not long ago, like last week?
Friday at 3:45.
Yeah, it would, was there animals involved?
There was not.
Okay,
That's what I called you about, the barn fire.
Yeah, it was Lermo.
yeah. Okay, I was just kind of curious if there was.
Yeah, no, he had just, all his animals went to slaughter, so it was that time of year for him, so there was none in there. It was all equipment.
Okay. Yeah, I figured probably a heat lamp for cabin.
Yeah, it wasn't, no.
Okay. Well, thank you.
Mr. Castillo.
Yes, looking at the back, okay. Volunteer firefighter recruitment and retention task force. I mean, at the last meeting, I made mention of, I was wondering if it was maybe time to revisit the countywide fire district. I was just wondering, getting any feedback, I mean,
So that,
throw it out there to anybody or anything, because the only reason I keep bringing this, I'm trying to revisit this, is because it's not like it was when I was in my 20s, where people would just join the fire, be a volunteer fireman, and they'd sit around and then they'd be able to go out and fight a fire. They can't anymore. And it's very, very difficult to get people to take that move because of all the training that's involved, the cost, it's all involved in there. And you have less people because you have more people working and they can't leave their job. And that's why I'm bringing it up again.
I don't think it's a bad idea. That report came out last month, Fire Advisory Board. The president of that we had to reschedule a meeting. That's going to be tonight, so that's one of the topics is that report. In some ways that we can, or the Fire Advisory Board can recommend to the legislatures on some of the recommendations that that committee has handed down. So that is one of the topics for tonight's discussion. We probably should have a discussion sooner than later instead of it just, it's easier to plan than it is to have it fall in your lap at the last second. So it is an ongoing issue every day. And with that task force, that's going to help some things.
I mean, the main thing first is you have to have a countywide water district before you can have a countywide fire. The biggest issue is water in a lot of places, right?
Yes and no. Some of the more rural areas aren't completely hydrated. Where you're seeing it more and more, towns and villages expanding out their water districts.
Which is helpful. Very helpful.
It is.
If you have to run your trucks, you're talking about saving something or not saving something.
Yeah.
But I know it's not easy. And I know there's a lot of kickback. There's a lot of people that aren't in favor of it. But, I'm looking to try to save people and save lives and save people's structures.
Yeah. One of the recommendations that come out of that committee was paid, but they didn't expand on that. So whether it's paid per call or paid, yearly, there's still a lot of work from the OFPC stuff in the governor's office that's going to need to break that down.
Right.
But at least there's good recommendations in there. I know one of the things they just kind of pushed through quickly was property tax exemptions. I missed the webinar because I had another meeting that night, so I don't have much details on that, but I think it's more than what they originally gave. I think it's 10% of your assessed value. Right. Of the property's value.
Of your primary residence portion of your property.
Right. So, that might help some individuals. Me, for instance, I volunteer in Granby, but I live in the city, so I can't collect that because it's not in the area to protect. So, there's still some loopholes in that. There are other people that, have the same issue that where they live, where they protect.
And that is an opt-in. So
Right.
that is something that we would need support of this committee to start off with at the county level to opt into the possibility of that.
So my hope is tonight, one of the topics that they're going to discuss and see where they push that is if they push that forward and that's something they want, comes to this committee and we can get it through the ledge. I'll have more information on that hopefully for you next month.
I think that'll help retain people, but I don't think it's going to help us move forward. So I'm encouraged by your open house and the advertising platform that you use to get this out to the kids, because they don't watch the news and they don't read the newspapers. And the more we can attack this, I think the better off we're all going to be. So,
Well, I think some of it was I can offer something where you don't have to go running into a burning building and you don't have to carry a gun in your head.
A lot of people like doing that, though. That's a code.
Well,
Right? So
they're getting a salary, right? So I think one of the big concerns when you read that report, a lot of it's being driven monetarily.
Sure.
So people want compensation because, again, as it stated, the cost to just run the fire department or to participate, then you've got the training hours and everything else that goes along with that. So it's not just answering a call. You've got to get trained people in there
to provide the best service to our stakeholders, to our taxpayers.
And I agree with that 100%, but first we gotta get them through the door.
Mhm.
So, if we can mirror this in all our departments, and perhaps the fire department attack that as well, maybe we'll get some more volunteers to come out, and then we can start worrying about some other stuff. But we gotta get a hold of the kids. We gotta get it out to them. And I understand your point, some people don't wanna run into a fire, some people don't wanna carry a gun, but I got this here, a lot of kids do. You know, they do, they just don't know how to do it. Nobody's encouraging them to go do it, they don't have the information. This is all they know, it's hard for them to go and talk to somebody in person. So if we can get it out to them, that's all I'm saying. I understand that there's other venues that we have to address.
Another avenue we're looking at, it's gonna be discussed tonight hopefully, is that, like the county search and rescue team, those are private citizens that do that. One of the avenues we're looking at is, a lot of people might not wanna be members of a fire department, but maybe, like, so with all of our special teams, for the county, the hazmat team, I need people that are, scientists, lab people, divers for the county dive team. They don't want to be part of a fire department, but they're certified to dive and they'd be part of that team. So another avenue we're looking at, and we got to bring it to committee, would be to have citizens join these special teams to help offset that lack of manpower.
Sure.
So
that's a great idea. I mean, any ideas we can come up with, encouraging.
Is there something hands-on that you can talk about? If you were to have an open house, like they had the drone and their equipment, can you blow something up? I mean, that's gonna grab their attention.
The fire school I can burn all day long, but basically what happens is that we're not a county department. So everybody has their own department within the county, their own fire department. So those departments are tasked with having, as legislators mentioned before, their own open house. There's a time of year that they do that. Some participate, some don't. So that's one of the things that we should be pushing them to do, is have those open houses. Second thing is that what I do at a county level is more than what they would do in the local fire department. So, they're not necessarily running to burning buildings. We're there to, our office, what we do for them is we're an asset to them. I bring them resources, I bring them people, I bring them equipment that they typically wouldn't need on a day-to-day basis, but we have it because it's a county entity. So we've had open houses at the fire school. They have been well participated. I don't have a problem doing another one. One thing we're looking at doing this summer with recruitment and retention is Sean Baird is working with the school districts, and we're going to do like a junior firefighter program where it's a couple days on the weekends, whether do extrication, burn building, outside props, to again entice that younger generation, those younger people to hear, this is an opportunity for you, and these are things you can do to give back. So that is also something we're working on.
Very good. Anything else for Shane?
Okay.
Bob? Oh, I'm sorry. Herb, you have a question?
I think what would be a good idea is, you got a lot of different smaller fire departments, but they're active. And instead of having an open house, or bring in Redfield, Oswego, Williamstown, combination of fire departments to have an open house.
Mhm.
So, because I went to all the open houses of my area the last time we had it, one department had an open house. Everybody else was closed down. But if you had a central location, whether it's Orwell or Sandy Creek, and bring in 4 or 5 fire departments in with their equipment, and make it like a big station, give hot dogs and whatever, but bring the people in.
Yeah, we've tried, I've done a ton of work trying to do the same sort of thing we just did. Now one at Hastings, my department, brought in rollover simulator from Phoenix School District, their bus rollover simulator, borrowed the SCBA trailer, the fire prevention trailer, fire extinguisher prop. We burn up a vehicle, just trying to show and do things. Didn't get a ton of attention, didn't get a ton of traction in Hastings. So then started working with the town of Hastings and started going to Walmart. Got a lot of kids that came and looked at the fire trucks and, played with some of the things, but no applications for any of the departments in the town of Hastings out of that. Sitting at Walmart for 4 hours at a whack, and we did it 4 or 5 times. So put over 16 hours of their time, let alone all the organization and stuff, and none of us got a single application out of it. So I think it's a little different, unfortunately, than like what I just went through, but.
It's a multi-tiered thing, right?
It is.
So we have to be able
You
to
gotta get
entice
the
them,
info out.
whether
Exactly.
these laws come out from the state, allow us to pay them somehow, or, a property tax exemption. We have to give them something in order to get them in the door. Like with Kevin's 911 thing, it's a job opportunity, it's a new program with it. It's, that's different. This is a job, but they're not getting compensated. So, what am I gonna get for not doing, what am I gonna get for doing something? Well, we can give you this, we can give you this, we can give you this. Right now, there's not many of those options out there. You tell a 19-year-old kid, we'll give you property tax exemption, they're still living in mom and dad's state.
Are they doing something where you get free tuition from the state?
That's one of the things, yep.
Community colleges.
That's still
Community
going?
colleges, yep.
Right now, there's a $200 income tax deduction. They are also talking about increasing that, and that would apply more to the younger people who are trying to draw into it. For the tax exemption, that's great. I've been getting $200 a year off the income tax. The property, mine would probably be like $400 a year savings. But it's gonna be, your older people are already in there. All right, it may help with retention, but your recruitment, you gotta be looking at the kids that are still living with mom and dad or have an apartment.
Sure.
And we really should be focusing on increasing the income tax reimbursement if you want to draw those kids in.
Sure.
And you get them past 5 years, you usually got them hooked. The average firefighter stays about 5 years. We can get them past that 5-year mark. Now you got somebody that wants to stay, and it's easier to work on retention at that point. But to get them through the door, you need an incentive for the young people that don't own property.
And we talked about the last NISAC meeting, trying to raise that to 500. And then that's when they came back with this 10% tax exemption, or property tax exemption. And we talked about it in that meeting, that this is good for one hand, but the other hand is not hitting, so.
You apparently can't do both. You can't,
Correct.
the county's gotta go one, or the county's gotta go the other. You can't do both.
Yeah.
All right, anything from the DWI coordinator? Are you still a DWI coordinator?
I'm still interim, still looking for somebody to do it. I'm taking care of the administrative and financial stuff. Due to personal reasons, I'm not able to go out and do the school activities, community activities, and we're still trying to find somebody that will step in. And at this point, if somebody will step in and do the administrative stuff, I'll teach them how to take over that, and then they can figure out how to expand the program back to where we were. But we're struggling right now with it.
It's because he's got all the retired guys in the schools right now.
You're exactly right. And he can't get enough, so I don't know how we're gonna entice somebody to come over to do this.
Okay.
I'm here as interim staff DWI coordinator, but I also came as a member of the county fire advisory board and a fire commissioner for the town of Oswego Fire District, to answer anything that you might have as far as what Shane had brought up.
Any other questions? Ben?
I just, this group, I don't know what part of the group, but it's school district, within the last month we had an incident at the high school, an evacuation of the high school. Anybody called in on that or anything with the sheriff or?
An evacuation, or?
We had an evacuation of the high school.
No, that was within hand.
You're not about to hear them.
No, Fulton.
They took care of that themselves.
Yeah.
It was handled by Fulton PD.
All right, so we don't know how we handled it, if we handled it. I mean, because it's an incident, that it seems as if they would have called, somebody from, us to say, okay, this is how you handle it, this is what you did, it could be improved or not, because the reason I say it is because I know the transportation was criticized for not having buses there to evacuate the school quick enough, and where they were staged, stuff like that. So, that's why I'm bringing it up now, because I think it's something that our group should have been brought into somewhere. Somebody from our group should have been called by the school district. I can't see why people are constantly trying to do things on their own when they have a group as talented as widespread as we have, within this room, and they handle it themselves. Well, come on, that's what the problem is. People are trying to handle things on their own, and there's a lot of good people here that can help handle things. So,
I think that's a question for the Fulton School District.
I question them, and they don't like the questions.
Fulton PD handled it, they'll show up at the next CSI meeting, you can bring it up then.
Okay, all right, good enough. Okay, we can bring that up next Thursday then.
And certainly if we were asked, we would have been there. But one thing we're
Yeah.
working on, which I don't know when that'll be rolled out, is that notification trail.
Okay, all right, good enough. That's all I had. Okay, thank you.
Anything for Donna? You got anything? John? Don? Either one of you?
No, just same boat as everybody. We got 8 new deputies, should be on the road by, I think February, end of February.
Yeah.
But
Couple times.
the problem with that is, in the time since they've been hired and gone through the academy, and we've got 9 openings. And we've been informed, but the first step in the lateral transfer process for most agencies is that you have to notify your agency you're currently working for that you're going through the process. We've had 3 members notify me that they're going through that process with other agencies. That's on the road patrol side. So correction side is just, we've got some recruiting issues there too, but for the road patrol, we're losing them faster than we can bring them in.
I don't think an open house in the jail is gonna help you.
No.
It's always open.
We do all the social, we've been doing, I think that's probably why we've been able to keep it about even.
I do have a couple things quick. We met with Joe Medico last Wednesday in our MAT program, which is medically assisted treatment. It's going pretty well. Depends on how you look at it. I guess we're giving a lot of help to our incarcerated individuals before they get out. In our budget, we had asked for a nursing position and also a medical social worker. We haven't been able to fill them yet. So our number of individuals seeking the treatment is starting to creep up, but we're a little short on help, so we're trying to fill those positions. We have a nurse practitioner that's been with us probably 2 years now. Started out 8 hours a week. We doubled her to 20 hours a week that she's working now. She actually was working down in Syracuse at ARC and doing all types of the medical assisted treatments for people in substance abuse programs. I submitted to HR when I submitted for the corrections a thing because she's willing to come to work full time for us, but for a price. When I submitted to HR, we submitted a plan deleting one of the medical social workers that we have open, because we have 2 open positions, and trying to bump our nurse practitioner from 66,000 to about 121,000 to go from 20 hours to 40. Problem is there's no positions within the county for a nurse practitioner to make that much money. So Sheriff and I met with HR Julie Bell last week and didn't come up with any options, so we're still working on it, but I'm kind of just giving you a heads up on it, that it is something. We're trying to get her more money to work full time for us, and also a social worker or an RN to do some of the discharge, because we're up, as I said, program, I think we have close to 40 people, inmates that are being treated with, I guess, new medical things instead of bringing them in and not really doing much for them. There's different drugs they're getting, there's counseling options still. We're meeting with Farnham and County Mental Health this week to discuss expanding some of those programs. So I'm giving you a heads up on that. And again, there's probably money within the budget, it's just finding a way to hire people at a salary that they're willing to accept to do the job. And then on a more positive note, I did get Friday a grant that we put in through Assemblyman Will Barkley's office for a body scanner. So when the inmates come into the jail, they get scanned. We had talked about it during budget for ARPA money or capital project. It's $160,000. This way the corrections officers don't even have to touch somebody. They can scan like the airport. It'll also take their temperature, so there's no contact till you know how high And again, it's $160,000, but the Assemblyman put something through to give us $100,000 grant on it. I gotta get it.
So you need
Figure out how-
60
I gotta figure out where Phil's gonna give me $60,000.
Comes out of internal. Okay.
Yeah, I know we talked about it on Monday, but they just got that Friday, late Friday afternoon.
So if I go back to the mat problem, here's what we're facing. The reason she's available is Onondaga County just went to, they hired out to a company. We have been, since we took over, trying to avoid that. It's this crazy mandate put on the county with no funding. And if we can't recruit people, what's eventually gonna happen is we're gonna have to, the commission's gonna demand that we hire a company to come in here. It's at least twice as much as we're spending right now on salaries. And we lose control of the program. So I don't know what the solution is, but we're doing our best to avoid hiring an outside medical agency to come in here. But all the agencies around us, Cuba County just went to it, I think Jefferson County, Onondaga County. It's not something we want to entertain, but at some point we may have to. And it would be millions of dollars.
Is this something that the state is mandating that you have to go to the outside if you can't find?
The commission's correct. Well, the new MAT law, I'd say new, it's been in effect for at least a year now. And we've been piecemealing it and managing to, but our numbers were about 10% of the people that were using the drugs. Now, we're being told they anticipate up to 75%.
Hopefully they put people in jail anymore.
One of those people that Our facility, if I can, our facility, speaking of that, our numbers, we're back to max capacity. We're housing out more female inmates right now than housed in the facility.
The state did take some city correct in lieu of that, but we were full plus, I believe we had 11 housed out at one point.
We've been fortunate that the new Ontario County Sheriff hasn't been billing us. We bought him a few beers. Now, it is, in the past, it's an unwritten rule. You know, we'll take theirs if they need them, but more and more that's coming.
The last 2 years, we took advantage of needing theirs. And again, mostly females, but we've had that issue with.
Now, somebody told me that they took Farnham out of the jail. They're in there now, right?
Or we're meeting with them to come back.
Counseling.
Okay.
Farnham's been in and out, and sometimes it's because it depends on what grants they got and what they've got to do, and you know, they're thinking anything bad against them. It seems like every time they wanted us to take the individuals out of our facility to go to them for counseling. And we flat out refused, even though they said there was some grant money for it. But we said there's not for the overtime, the transportation, and all that would take.
We'd
So
have
I
to
think
hire
we're sitting down for them to come back to us.
or officers.
You just don't have enough people to be able to transport, plus the money would cost.
I mean, we're looking at 30 individuals, or 40. I think it's 38 as of last Wednesday that were on the program that would have to go out for counseling like several times a week. I mean, we don't have the officers to do it, we don't have the vehicles, and
Originally, our plan was to contract with them, Farnham, to run the medical assisted treatment program, but it was just personnel. They won't or can't come into the jail to do it. And we can't afford to transport to Farnham every day.
so we're hoping that meeting this week is them coming and say, no, we'll come in and do some of the treatment and give us some options for them coming in. And we're meeting with Nicole, Farnham, and our medical team. I believe it's this Thursday.
Well, if you keep increasing, you probably have more in jail than they've got, so it's kind of a no-brainer they stay in the jail with you.
Plus, it puts them in a program that when they get released, they continue their program with them.
Right, that's perfect. Nice segue.
Can they bill for, like, they can bill, right, for any incarcerated individuals that they treat?
Oh, yeah, Farnham's a great program, but they're a for-profit program.
Right.
So they're not coming in there out of the goodness of.
They're not gonna come in, just about, they're coming in and tell us a program that offer And I think Nicole's coming with them because there's money that Nicole has, the state to pay for it.
Sometimes I know it has to do with the site, but it's only charged by certain sites.
Sure, so the situation that you've got is that right now, like I said, it was at 10%, it's gonna go up higher, okay? And our answer is that in order to take care of them, we're gonna have to hire more to take care of it, correct?
Correct.
But right now, we don't have an answer as to how we're going to classify these people to be able to pay them what they're looking to get.
Because here's the
What they
issue.
deserve,
That
Okay.
position exists in the county health department. So if we offer them the 121,000, the argument's gonna be, it happened with the county nurses and the jail nurses. So we had to create a specific job title as jail or correctional nurse. So we're able to, under that, give them more money. If the other nurses in the county argued, well, then we should get that. Our argument was, well, then you should come to work in the jail, because it comes with a certain set of circumstances working in the facility.
I understand where we're going there, but, I mean, and I got no problem paying what we need to be able to get the job done. At what point in time are we gonna say that, is somebody gonna come up and say, well, maybe we should firm this up because we can't hire people? I mean, that's one thing, and I don't want that to happen, so we have to come up with a job classification somewhere.
Right, that's why I'm letting you know that we didn't either.
Right, I know it's not you, and I know that, somebody's gotta come up with something somewhere for us, so that, and then we offer the money that we need to be able to get them. It's a mandate, and you know me, I don't like mandates anywhere, much as anybody else does, but, if we have to do it, then we have to do it, and we have to pay to be able to get it done. And I don't envy you the task of having to try to find somebody that's gonna wanna go into the jail and, get paid what they want. Like you said, the nurses at the health, in the health department, they don't wanna go because it's in the jail, but they wanna get paid. Well, that's the difference. You get paid what you should get paid for, doing the job that you're gonna be doing. I think you're doing, you're going about this the right way, and I know that you're gonna be hit hard soon, so. Keep up the good work. Thank you.
Hey, just one more thing I want to throw out there for the newer legislators that haven't had the opportunity to come down there. We normally do this with, many times elections, a tour of the facility if you haven't been down there. And I'll mention that at the caucus, the complete caucus, that any new legislators that haven't been down there, or anybody that wants to come down, you really should. You're voting on stuff that concerns the facility. You should have a working understanding of what happens there. So we'll arrange that.
Yeah, let's set something up.
Just for the record, it's the nicest police facility I've ever been in. All my years of policing in New York City, the county's in great shape as far as the building goes, and the stuff that they had down there is pretty new.
Some days it's nicer than others.
I can imagine.
Oh, physically you were talking.
It's not built in 1890.
Yeah. And I will say that was our reaction when we came here from working in Onondaga County, because I heard these rumors that my predecessor was saying we need a new facility already. We walked in, we're like, this is the best place I've ever worked at. And it really is. It needs some paint and some.
We did a lot of things, project on the workstations that is just about wrapping up.
Okay.
I think it's done a lot just for the correcting officers, having, instead of a rusted, broken down tabletop that they sit at when they're in each pod. The company came in and did that very quickly. I think we pushed the money through in like October, but it's almost completely done. There's a couple small touches they've got to put on, but I think that was appreciated down there to give them a little better workstation to sit at instead of the 25-year-old one that was there. So thank you.
I just have one other thing. Will the possibility of the closing of the Janesville Correctional Facility, is that going to affect us in any, do you foresee that coming at any point in time, or if they do close that,
I don't really think that's going to affect
Oh, okay,
us.
good. I hope not, so.
We don't contract with them.
Okay.
I wish they would have consulted us, because I did meet with and my sheriff and told them, you know, we're sending people all the way to Ontario County.
Right.
We're sending them all over the place.
Okay, good, okay, thank you.
Anything else? Hurt?
I think that when it was originally built, it's a setup on a pod system, so you could always add on more room to that jail. Maybe we should, down the road, start thinking about making the jail bigger and expending money, and then you take prisoners from all over the county and bring them here. If you make money out of it, you can't be pulling it out.
We were making money when we had the federal, I mean, that's how.
That's how we paid for the workstation.
Workstation
Through
program.
$220,000 we made last year in federal
So you could
prisons.
add a pod onto that originally.
That's what I was thinking about adding sentencing.
We'll make a second floor, and that's where
We
you
got
put
two
the
floors
judges
and
in
stop
place.
taking them.
That's a whole other.
It's not a ramp, but you can't put a second floor because they gotta have the mandated sunlight laws.
Oh.
All right, anything else?
It gets sunlight.
What a man.
Yeah, Mo.
Entertain the appropriate motion?
Motion to adjourn?
Second.
So done. All right.
Take it.